Great. Welcome back. We are now, we've talked a lot about the history and what we could do. Now we've got Jason Fitchner and Gopi Shah Goda talking about what is needed going forward. So I'll let you guys go ahead.
All right, thank you. I'm going to start things off, but Jason and I are going to do things a little bit differently, and we're going to have kind of a back and forth discussion. And there will be time for questions at the end. So I want to start out by just talking about a large debate that exists about retirement adequacy and put the Social Security program kind of in the context of the broader picture of retirement security. So the question that is often asked is, are too many people arriving at retirement without enough resources to achieve an adequate standard of living? And sometimes this is posed as, is there a retirement crisis? And this is an extraordinarily hard question to answer because it's really actually difficult to measure. And I'm going to spend a little bit of time just talking through some of the different ways that people have tried to measure this and how I think reasonable people can come to different conclusions on some of these aspects. So one of them is, what is an adequate standard of living? Is it the poverty line? Should we be thinking about how retirement income compares to some measure of pre-retirement income? So that's sometimes referred to as a replacement rate. Or should we be focusing on a particular dollar amount? Sometimes you hear things about you need to be a millionaire to retire, or how many people will have $1 million in retirement savings, and so on. How do we take into account both the stock of wealth? So this includes things like liquid forms of wealth in 401k plans or IRAs, but it also includes illiquid assets like home equity. And how do we take that and combine it with income flows from things like defined benefit pensions, Social Security, or annuity payments, which are, of course, rare? And how well is income from these different sources actually measured by household surveys? It turns out that some surveys actually don't measure all of these that well, and people do underreport some sources of income when they answer questions. Speaking about surveys, should we take into account survey responses? So the Federal Reserve runs several surveys that ask questions. Some of them ask questions about whether people are living comfortably or finding it difficult to get by. Then it also begs the question of what share is too much. If it's a 20% are finding it difficult to get by, is that a lot, or should we be thinking about how to reduce that? And one benchmark that one could use is, how do people compare pre-retirement? But that's also making an assumption that those people pre-retirement are okay. So let's compare those who are in retirement to those who came before. What about consumption data? Economists really prefer to think about well-being as measured by the types of goods and the amount of goods that you consume. And what you might want to know is whether actual consumption drops in retirement. And that would be some indication that perhaps well-being isn't constant. But even that is challenging. Even if we had the best consumption data in the world, this wouldn't take into account the fact that there are other reasons that consumption might drop in retirement that are perfectly reasonable. For instance, you might prefer to cook at home versus eating out, and this might show up as a drop in consumption, even though in both situations there's no food insecurity. Another question that comes up in this debate is, should we think about people who are retiring or claiming Social Security early as having liquidity needs, and that's why they're claiming benefits early? Or is it because they're unable to work a physically demanding job? Is it actually that they need the money, or because they can afford a longer retirement? And similarly, if someone is working longer, is that because they feel they need to, or is it because they enjoy their work? And so it's very hard to look at some of these measures and say that people are actually better off or worse off in retirement than and kind of draw conclusions from that. But really, what we would want to know is, has this changed over time, and how does policy and Social Security benefits actually influence this? And this is kind of a hot debate, and largely due to a lot of the differences in answers to many of the issues that I already raised. And some say that there's an urgent crisis, and others state that there's really no need for concern. And these debates really matter. If there is indeed a retirement crisis, then it begs the question of what are we doing about it? And it bolsters the case for policies that either expand Social Security or provide additional subsidies for saving for retirement. What I'm not going to do is actually take a strong stand in this debate. And rather, I think that where I want to go is that we should maybe be reframing this debate and think about it a bit differently than retirement adequacy. I think we should be thinking about it as how do people manage risks that they face as they approach retirement and as they live through retirement. And I'll talk more about these risks as we go on, but I'm going to hand it over to Jason for now.
Thanks. And first of all, I want to thank Stanford and CEPR for hosting this and having us here. This is a wonderful thing. It's great to be with all of you, friends and colleagues. I want to respond to things Gopi said, but I also want to level set for a minute because we've been talking about terms and concepts. We've all touched on this, but for one, just so everyone understands, Social Security is not going bankrupt. The program is not going insolvent. What we're talking about is the trust fund being depleted. And because the trust fund is depleted at that point in time, Social Security, by law, current understanding, can only pay out in benefits what it has in revenue, which will be primarily payroll taxes. What does that mean as far as where we're short? So, Kristen, you mentioned that payroll taxes would cover roughly 79% of benefits. What if we wanted to increase taxes? If we did that, if we did it today, it'd be basically a 3.3 percentage point increase in the 12.4% payroll tax. Just for Social Security, it wouldn't include Medicare. That brings it to 15.73, and that's a 27% increase if we want to achieve 75-year solvency, which we can argue whether that's a good benchmark or not, but that's where we'd have to go. Or we borrow roughly $350 to $400 billion more a year already on top of our large, massive debt and deficits. So this gets into how do we talk about this, and this panel discussion that Gopi and I are having is how do we rethink Social Security? So Andrew's also mentioned the word pension. So Social Security, technically, and you mentioned this, Kristen, is OASI, the Old Age and Survivors Insurance Program. It is not a pension plan. It is not a retirement program. It is an insurance program that is supposed to protect you from the vagaries of old age and survivors. It has morphed into something socially much different now. People consider it their pension and their retirement. But what if we had gone back and go back to being a retirement, not a retirement program, but an insurance program, like the disability program is? That kind of gets into your proposal you're doing with Andrew, because in some ways that keeps it as some sort of a insurance program and not something that's basically gives higher income to people that don't need such insurance. To an economist, and all the public finance folks here realize when we talk about insurance, insurance is something you get to cover a high cost but low probability event, right? Your house getting up on fire or something else like that. It's not supposed to be because you retire. Hopefully retirement is not 100% for everybody, but it's a higher probability and also a higher cost now. You don't insure your car for brakes. That's part of maintenance. So I think when we start talking about this idea of adequacy and what it actually means, we need to start considering, as Gopi said, how we reframe the debate and the discussion. And so part of this, based on my research, is we are now what we call in the peak 65 zone. So starting this year in 2024 through 2027, 4.1 million Americans are turning 65 every year. That's 11,200 a day. This is all coming on top of a complete change in our retirement security and how we talk about it and what it means. So we used to have conversations about the three-legged stool. A three-legged stool gives you stability in retirement, and that was consisted of three legs. One was Social Security. The second basically was a defined benefit pension plan, and the third was your personal savings. So now what we're seeing is Social Security does have wobbly finances. Your defined benefit plan, most people don't have a DB plan anymore. Only 4% of private sector workers. It's mostly for government employees, state and local, and those have financial challenges. And then you get to your personal savings, which depending on your income could also be very wobbly. And at times it seems this three-legged stool is now a pogo stick. And so you're trying to bounce around and get retirement security on various challenges of retirement security. Do we have a retirement crisis? What I would argue is that is the wrong debate, Gopi. You are right. I think what we have is a retirement income challenge. And part of that is what do we think about holistically when we think about retirement security as providing income that people need, whether it's to be above the poverty line, to have a certain replacement rate, to have the financial support and stability they want to have, but the idea is income. So our reframing should now be income is the outcome in retirement. And we reframe the three-legged stool. So Social Security is still part of that leg, because for most people, Social Security will be the prominent source of their protected income in retirement. The DB plan is now gone. It's now basically a DC plan. But the benefit of a defined benefit plan, when it was funded, is that you got a paycheck for life. So that on top of Social Security usually provided people with the income they needed in retirement. And most financial advisors suggest you have 70 or 80% replacement rate in retirement. Social Security is designed to be about 40% on average. It's higher for lower income lifetime earners. It's less for people who had higher earners. But your pension can make up the difference and maybe get you to 70, 80, and then your personal savings got you the rest of the way. Now we just shore up Social Security, but that second leg is now the defined contribution. And this is the income challenge. So a lot of people, we tell them, save, 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 save. Then they get to retirement. We say, spend. They don't have a spending plan. They see that asset. They're afraid of spending it down. They're afraid to spend it. They don't know what they count on they're going to live. They don't know what their income needs are going to be, their healthcare shocks. We need to help convert that defined contribution asset base into another form of protected income on top of Social Security, so we replenish the three-legged stool idea and then help people with their personal savings. And this gets something you were talking about, John, which is the ecosystem has now changed to a lot of people having 401k, 403bs, IRAs. We need to make sure that people have access to that, because if they have no assets to turn into income, doesn't help. But we can do things with access, whether it's state plans, whether it's a mandatory IRA or something for individuals at least have access to it, where they can participate is one thing, and reframe the debate around income being the outcome of retirement. And that's kind of how I think we should think about this when we talk about Social Security, because that also leads us to a variety of discussions about how we manage risk, which Gopi's going to go into in a minute, how we think about reform options. Because when someone says means testing any program, means testing typically to the average person means that your benefit check could be reduced if you have higher means. But that's a reduction in that monthly check, and no one likes to see it. There are other ways to do means testing. You can take it back on a 1040 when someone files their taxes. So if we're concerned about people who even might get a benefit cut of Social Security who are higher lifetime earners but have less income or assets, you could recapture it in some ways on the 1040 by having right now up to 85% of Social Security is taxable. Have 100%. You could have a separate rate for Social Security depending on people's income and assets and what they're reporting. There's a variety of ways we could be more creative if we think about this as an income challenge, because then on the 1040 you can correct for things. And Social Security, while it still needs to be solvent to pay out benefits, we could recollect things, and one of the sources that Social Security has now as revenue is the taxation of benefits, and that could still be one if we do something with this going forward. So what I would suggest is we, again, like as Gopi said, we rethink Social Security, we rethink retirement, have a larger ecosystem, think about what income people need, and also think about how we manage the various risks that they have in retirement. And with that, let's talk about risks. Gopi?
Thanks, Jason. So I agree with you that income is really the outcome, but I also think that for a certain level of income to be adequate, you want other risks to also be managed. So what kinds of risks am I talking about? So let's just say you're 50 years old and you're gearing up for retirement. What is adequate or not depends on how some of the following play out. So one is, what is the chance that I will experience a health condition that limits my ability to work that will lead me to retire earlier than I otherwise would have? What is the chance that I will live to be very old and, past my 90th, 95th, 100th birthday? And will I outlive the savings that I've accumulated? What is the chance that I'm widowed at a relatively young age? And what stress might that put on my finances? How will the stock market perform? What will inflation be like? Will my sources of income keep up with the prices of the goods that I purchase? And what is the risk of Alzheimer's or related dementias or other conditions that cause my health to deteriorate to needing care for a long period? I think a lot of those questions will determine whether your particular amount of retirement savings is adequate or not. And I want to emphasize that Social Security is not just a transfer program, as Jason was saying. It's also an insurance program that plays a big part in ensuring some of the uncertainty I was just talking about. So for instance, Social Security provides longevity insurance. It provides benefits every month until you die, and no matter how long you live. And that ensures this risk, this at least partially ensures the risk that you will outlive your savings. It also provides some valuable inflation protection by indexing benefits every year to the consumer price index. It provides a valuable form of survivor's insurance by providing benefits to a surviving spouse in the case that you die. And we're not talking, this isn't the focus of this session or this conference in total, but it also has another separate piece that provides insurance against disability. Work limiting disability that causes you to exit the labor force. And all of these forms of insurance have some value in helping people protect some of these risks, but it only does it part of the way. There are still several risks that people still face in retirement. I'll hand it back to Jason.
Thanks, Gopi. And I think a discussion of risk is important because one of the fellows here, Henry Osardi, has done work on risk literacy and how people don't understand and comprehend risk, whether it's longevity risk or healthcare shock risks or the risks they might face in retirement. And not to be a Debbie Downer, but just to give some statistics that we use in my job running the Retirement Income Institute. The greatest threat for financial security for many older adults is not a recession, it's not a market correction or inflation. It's the risk posed by a health-related shock. So roughly 78% of adults over the age of 55 in the US have been diagnosed with at least one chronic illness, such as diabetes. And 64% over 65 suffer from two or more. About 116 million Americans have hypertension, and 800,000 people in the US experience a heart attack every year. I'm glad I went for my 3-mile run this morning. Hopefully it'll help. And 1.9 million people basically are diagnosed with cancer each year. So we have some sobering statistics in the healthcare, and how do we start managing risk? And I think part of this is thinking about when we looked at how we've changed the retirement ecosystem. For, again, going back to that three-legged stool and thinking about it, two of those three legs were basically sources of protected income. Social Security, which is an insurance program, and that is an annuity. So Social Security retirement benefits are an annuity. People forget that. They don't like the word annuity, but it is an annuity. It pays you a monthly benefit for the rest of your life. That's an annuity. The second part was a pension that gave you also protected income, but of course those finances didn't always revolve. And now we've transferred some risk to individuals with the DC plan. We need to figure out how to transfer some of that risk back to somebody else. And there are companies that are very good at managing risk. They're called insurance companies. And so part of this think about how we could take Social Security, and this goes back to the idea of whether you're talking about replacement rates or healthcare risk, but talking about what the income needs might be at various stages of retirement. Planning accordingly, Social Security provides this base. How much extra do you need in protected income from maybe converting part or some or all of your DC plan into some sort of annuity product that then helps you get that rest of it, and then what's left over stays in the market so you can get access to market growth, which also helps protect you against, in some ways, inflation. So it's rethinking this. And I give a lot of talks to financial advisors, and I ask them, what risks do you talk to your clients about? Longevity risk is the biggest one. Healthcare risk, market risk, sequence of return risk. If you're trying to do a 4% drawdown rule from your assets, and basically you get a 20% correction 20 years out, you're fine. If you get a 20% correction the day after you retire, you're not fine. These are all risks they consider, and I've started talking about a new risk that I want to talk about, which we're kind of hinting at today, and it's called political risk. Who is going to be controlling Congress in 2033, 2034, 2035? Who's going to control the White House? The proposal that Andrew and you and Kristen are talking about, my guess is from a political standpoint would be a much different sell, whether a Republican or a Democrat's in the White House, who controls the Congress. We need to start thinking about what this means. I'm not trying to scare people, but it goes in the idea of we need to start planning. One, we need to plan for what happens if Social Security gets reformed, who's going to bear most of the burden of the changes on taxes or benefits. And if it doesn't, what does that mean for planning for retirement when thinking about various risks? And I think those are some of the important things we should talk about as well. Gopi?
So, I want to take another stab at some of what our current system is lacking. And I think one of the biggest ones is the one that Jason mentioned, which is basically the need of needing the risk of needing long-term care for a long period of time. And that is one of the biggest expenditure risks facing the elderly. Over half of people age 65 will face some kind of care need in the future, and a significant portion will face care needs that exceed 5 years. These costs can be very expensive and are ones that are not generally covered by Medicare or private insurance plans. So how to ensure these risks that people face is a huge issue that I think can change the way we think about income adequacy in retirement. Just to give an example, I think if a lot of people, there's evidence that people amass larger amounts of savings because there is this uncertainty in how much you will have to pay for long-term care out of pocket. And if that risk were somehow managed, either by a public insurance program or a private insurance policy, that means that you have less need of resources in retirement to finance your otherwise annual expenses. And so I think that this is a big issue that should be thought of when we're thinking about where our system is lacking. Another thing is, like we've been talking about today, Social Security finances are uncertain, and how it will be reformed introduces a lot of uncertainty into how people are thinking about their retirement income. You know, if you're at the part of the income distribution where your benefits might be cut more, you face maybe more uncertainty than if your income is lower. But a lot of the ways that uncertainty affects decision-making is that because we don't know with exactly how these changes will play out, then a lot of people have to sort of plan for the worst. I also think that there's a feature of Social Security that makes this kind of uncertainty more inherent in the program. So if you think about, we've been talking about pensions, and there's two different kinds of pensions, defined benefit, which is virtually unheard of in the private sector, as Jason mentioned, and defined contribution. So how does a defined benefit pension work? Well, the benefit that someone receives in retirement is fixed and known, and it's based on a formula. And how much money an employer sets aside to fund that pension is uncertain. So they're bearing the risk of funding that defined benefit pension. On the other hand, defined contribution plans designate a certain amount that is contributed each year and up to leading to retirement, but then what you get out of the program is somewhat uncertain. Social Security, you can kind of think of as both having features of a defined benefit plan and a defined contribution plan, in that the payroll tax is fixed, so how much you're putting into the program is fixed based on law, and how much you get out of the program is also fixed. It's determined by a formula. Well, it's only by chance, in some sense, that those two things are going to equal out. And I'm glad we've had a great discussion earlier today about what might happen if those two things don't balance out. But I want to point out that that is something that is inherent in our system, that because we set both of those by law, there's going to periodically be times when either the assumptions that were used change, like fertility rates, as what we discussed, or economic conditions change to the point where those two are out of balance. And so if we don't have a way to think about the program in a more sustainable way, and not just think about how we balance revenues and expenditures, but also think about what happens when those two don't line up, that will basically just continue that part of that inherent uncertainty in the program that exists today and leave that uncertainty for the future. There are other ways in which the risks that older individuals face could be better managed. Similar to Social Security, Medicare also faces a financing shortfall, and how those are addressed will also have implications for the financial security of future retirees. And there are different populations that we might want to think about. in terms of how these risks are managed or not managed, one particular group that may face more risk is widows. So people for whom their spouse has passed away not only face some expenditure risks directly resulting from widowhood, but because they lack the informal care that their spouse might have provided in the case where they needed long-term care, they're also perhaps more exposed to out-of-pocket expenditure risk for nursing homes or home care.
Thanks, Gopi. I want to highlight some things you said, and also going back to this idea of reframing retirement, because I think it's important how we think about this when it comes to risk. So again, one is long-term care. And that's an expense right now. I don't think you can buy long-term care insurance anymore. I don't think an insurance company offers it because, again, they can't necessarily figure out what the cost is going to be, or they try to overestimate the cost and the premiums are too high and no one wants to buy it. So we have to figure out that is a big challenge, and I'm not sure what the answer is, but it does start thinking about how we can manage risk in retirement with different sort of strategies when thinking about Social Security and other types of income. And again, I'd go back to that three-legged stool. So part of this is there have been some economists, we will keep them nameless, who have a variety of books and proposals out there on how to maximize your Social Security dollars. And I think that is the wrong frame. That's an investment frame. We need to think about an insurance frame and how we can minimize your risk in retirement. And part of that can be looking at potentially helping to delay claiming Social Security, because Social Security benefits basically are based on a formula that says if you live to the average age, it shouldn't matter whether you claim at 62 or 67 or 70, but if you live longer, it does make a difference. If you live short, it makes a difference. But the idea, though, is if you delay, you get a higher monthly benefit for the rest of your life. That's inflation protected. And that higher monthly benefit might come in handy when you are older and need to have higher health insurance costs, higher health costs in general, or maybe long-term care. So to give you an example, if someone was supposed to get a Social Security benefit of $1,000 a month at age 67, their full retirement age, they would get $700 at age 62. Right? That's a 30% reduction. If they wait until age 70, it's $1,240, a 24% increase. But that $700 to $1,240 is a 77% increase in your monthly benefit. That is then inflation protected for the rest of your life. And you may need it more when you are in your 70s or your 80s and 90s than you do that smaller income amount when you're 62. Now, some people do need to claim benefits at 62. I'm not saying don't do it, but it becomes more of a better discussion now about what does it mean to claim Social Security and how do we defer and help facilitate delayed claiming. And again, it's part of that three-legged stool, because one is Social Security, the second is, again, your defined contribution plan, which could be converted into some protected income. But that third was personal savings. And part of that third leg might also now include working past a certain age in retirement. There is nothing that says you have to stop working and claim Social Security benefits. They are mutually exclusive. You can continue working and not claim benefits. You can claim benefits and not work or keep working. These are basically things we start thinking about for, again, income in retirement. And one of the things that's always got me, I know Andrew's been working on this, when I was at Social Security as well with him, is the nomenclature we use on claiming is completely wrong. So, for example, we talk about what's called the early eligibility age. That's age 62. Who here wants to be late for their government benefits? Please raise your hand. It sends a signal that you should start claiming at 62. We used to use something called the break-even analysis, which says you took benefit 62, you'd be ahead for 14 years. Never telling folks after 14 years, if you were past 76, you'd then be behind for the rest of your life. Horrible framing. We've changed that now at Social Security. The second one is age 67, which is called your full retirement age or your normal retirement age. I'm not sure it's so normal about age 67 anymore. And the idea of full, well, if you have a glass that's full, it means you can't put any more into it or it spills over. But you can get a higher monthly benefit by waiting past age 67 up to 70. So why don't we change the nomenclature? Instead of early eligibility age, we call it the minimum monthly benefit age. Age 70 would be your maximum monthly benefit age. Imagine talking to someone now at Social Security and you said, hey, there's a minimum monthly benefit and a maximum monthly benefit. They're going to ask, wait, what? How do I get the higher one? What does that mean? So as opposed to early eligibility, which kind of induces early claiming. So I think we can think about things that would affect trust fund balances, and we have to for solvency. But there are other things we could do that are just changing things through regulation or simple legislation that doesn't change taxes or benefits, doesn't change the trust fund, but helps change the behavior about how we think and talk about Social Security reform. The other, going back to long-term care, is the house. For many people, the house is their largest asset when they are retired. that may need to be their long-term care insurance. That may fund their long-term care. And so I think we have to think more disciplined and have a larger discussion about the home as an asset source for long-term care. The research that I've done through SSA's Retirement Stability Consortium through the University of Wisconsin, I've shown that each successive generation is retiring with more and more debt. So it used to be the Depression-era babies, they paid cash for everything except maybe for a mortgage. But when they retired, their house was paid off. Now you see people using that house as a cash machine. They take out home equity, they refinance, and they retire with home equity debt as opposed to having their house free and clear, which again could be used as a source of income if they needed it to, if some sort of income shock. So I think we need to, again, re-talk about the idea of income and retirement. The three-legged stool needs to be redefined, and that will help us in sort of think about Social Security reform, which we can talk about too at the end of this panel. Gopi?
I just want to emphasize the point that Jason made about framing and how these benefits are communicated. You can think of the increase in the normal retirement age as simply an across-the-board benefit reduction. It effectively has the same impact on benefits received at different ages. There's an equivalent benefit reduction that goes along with a change in the retirement age. However, people behave differently depending on whether you change the normal retirement age or you just have an across-the-board benefits reduction. And that difference does point to the importance of the framing and the way that benefits are communicated to people, and in terms of changing the behavior of retirees when appropriate. So I just want to close by saying that when I think about Social Security, I think closing the gap, the actuarial shortfall between expected revenues and expected benefits shouldn't be the only goal. We should be thinking about how these changes can best help people manage some or all of the risks that they face in retirement. And we should think of Social Security reform holistically within the context of retirement security more generally.
And I would just sort of say two sort of general points. One, as Gopi said, we need to think about Social Security as part of overall holistic retirement security. So again, back to a redefined three-legged stool, reframing the debate about income as the outcome in retirement. I think those are very important. Thinking about how we help people get more protected income in retirement, because what we do see for many people who even have the means to spend more in retirement, they are afraid to do so. Some of them die with their assets in place, and they're so proud when they're near death that, like, I didn't spend down my principal. I lived off the interest. Like, you could have had a better life. Yeah, but I wasn't sure how long I was going to live, or I have a bequest effect, or something else is making them afraid to spend the money. We've done research, David Blanchett and Michael Finka, and we call it a license to spend. What we find is that people tend to have a budget constraint. For those who are working today, we get a paycheck. That paycheck generally is what we spend our money on. We have some savings, we pay debt, we go on vacation. That is what an economist calls a budget constraint. People have that in retirement too. And so they see Social Security as part of the budget constraint, but the rest of their income sources may be variable. Stock market risk, they don't have a pension. What if we can do something to help facilitate additional income protected on top of Social Security? That gives people a license to spend up to that amount. They're more secure. The rest of their assets can stay and grow over time for shocks, medical emergencies, or bequest effects. So again, it's rethinking about this in the concept of a new three-legged stool. Income is the outcome in retirement. And then the second part of this is thinking about Social Security's finances. I do think, and the Jason I am today is not the Jason I was 10 years ago or 15 when it comes to this, because circumstances have changed and the financial challenges have changed. The opportunity cost of delay is huge. When I was at Social Security over a decade ago, if one of the options on the table was just to eliminate and raise the payroll tax, so get rid of the payroll tax maximum, that alone would have been enough to give you 75-year solvency. Now it doesn't get you there. Now it's an option, but it is not the option you can do. We have to make tough choices now. And think about what this means we may have to sort of sever that tie we've had, that it's an earned benefit, that it's only on payroll taxes, because payroll taxes are a big burden for employers and for employees. And think about other sources of revenue besides general revenue. Maybe, and I'm not saying I'm signing on to it, but you could think about a carbon tax or a small financial transaction tax. There could be a small VAT. Those things tend to get larger over time, which I'm not really a big fan of it. But the idea is we need to think outside the box and not just think about burdening payroll, because we are seeing shifts in the labor market In the same way we are thinking about shifts in utility. When something costs more, people demand less of it. So I was thinking, Kristen, when you started your talk, you said you have 4 kids. The fertility rate is now less than 2. On average, Kristen and I are doing okay. We're at 2 because I have 0. But the cost of children, raising children, putting them to school, it's expensive. It's a burden. And a lot of people, even in European countries, we're seeing this trend happen now over time. So maybe we rethink about what things people are avoiding because of the high costs and try to think how we subsidize things or change the incentives so that we can tax something that wouldn't change behavior, and those could be additional dedicated resources for things like Social Security. Not signing on any one plan now, but I think we need to think more, again, holistically about our options when it comes to financing the challenges we have for tomorrow's retirees.
Great. We're gonna have about 10 minutes or so on discussion on this paper, and then we'll go to general questions from discussion amongst you and questions from the audience. But I think Andrew and John both had comments. Did you?
Oh, sure, go ahead.
Well, first of all, I thought both of your presentations were good, and thinking about these risks and more comprehensive look at retirement and so forth. The switch from DB to DC plans is a big deal, and converting DC plans into what you call protected income is not easy. For instance, if you wait until retirement to buy an annuity, the adverse selection problem is pretty severe, and so the pricing is not very attractive. I recently did some work on deferred life annuities, which you might buy at 50 or 52 or 54, some age like that, where you know much less about your health status at the time of retirement than you do at the time of retirement. At the time of retirement, most people know quite a bit about their life expectancy. They know whether they've had cancer. They know whether, and so that market is very imperfect.
So let me just comment on that, because we're trying to design, we're in the solutions business, right? There might be second best solutions, but we tried in the solution business. So one, and this has now been researched that there are products now with BlackRock, TIA has been doing this for years. So one is the idea that you could start putting in annuities in contracts as part of a target date fund. So a default now, most people invest in their defined contribution plan through a target date fund. It says what you think you're going to retire, and it rebalances automatically for you. You could have thinking about protection now as an asset class, John. So you have your equities, you have your fixed income, you have your international. One is now protected income, which could be a switch basically in your fixed income, because that's kind of what you're looking at, paying off some bonds for fixed income. So you can start buying it along the way. The second is there are pricing mechanisms. When you think about the idea of insurance, it works because of a large pool, right? You basically can sort of average out. You get a large pool in. You sort of avoid these moral hazard issues and adverse selection issues. But the question is, maybe someone doesn't want a lifetime income product. So what if we start thinking about like a little bit more novel approaches? So one could be, when I've talked with Andrew about this, a bridge annuity. So if someone gets to age 62 and they say, look, I want to retire. I've got my defined contribution assets. And we say, we got a product for you. It's a 5-year fixed term annuity. Easy to price because there's no longevity risk. We will basically give you a 5-year fixed annuity that mimics what could be your age 62 Social Security benefit. You now get that for 5 years, and it facilitates delayed claiming Social Security to 67, which is then a higher amount that is indexed and inflated, shouldn't adjusted for the rest of your life. That is sort of one way we could think about how we could put some protected income into a holistic approach to reform. The other is something that TIA has now. They just don't advertise it very much, but it's called an income test drive. Basically, you can take out an annuity, and for the first 2 years, you get payments. And at any point in time, those first 2 years, you don't like it, you get the rest of your principal back. The idea is people are going to like getting that paycheck for life. And after 2 years, they're going to stay in it, and they're defaulted into the product. So we can think about how we could use defaults, but recognizing that one size default does not fit everybody, and what solutions could we offer, again, thinking holistically about Social Security and retirement security reform.
Well, this is great. I just had 2 thoughts, one of which is kind of a joke, but
We need a joke.
we do need a joke. But when Gopi sort of summarized, what we know about the data and research about retirement income adequacy, and I think it was an accurate summary, but the way I jotted it down is we don't know how much money retirees have, and we don't know how much money they'll need, because but this is legit. We have weaknesses in the data. of, most household survey data is terrible at measuring retirement incomes. But we also have weaknesses kind of in the theory of saying how much do people need. And I'll touch back on that, but let me lead into the discussion you both had of risks. And all of this is true, but sometimes when I look back, and that's one of these rhetorical questions I have of people say, oh, we're all going to hell in a handbasket, is why don't we have a retirement crisis already? It's DB pension participation peaked 50 years ago at less than half the private sector workforce. We've always had issues with health risks, long-term care insurance, or long-term care policies were always sort of a minority of people. Why? Given all these risks, which have already existed, why do we see in survey data that retirees are more financially satisfied and secure than pre-retirees? And if you look in something like the HRS, that self-reported financial security improves as they get older. The older retirees are more financially satisfied than the younger retirees. And so it's not to say that these risks don't exist, but I do think we want to be careful about thinking about how large they are. If you think about something like long-term care and you read a magazine article, oh, you could pay this for long-term care each year, the reality is almost nobody does. Whether you look at retrospective research, you look at projections that like HHS makes, your typical person is paying nothing for long-term care over their entire retirement. And even for those who do, it's pretty limited. So just to get back to the idea of how much people need, I do think looking at self-reported financial security or satisfaction in retirement, things like that, it's easy to deride them when you just ask people survey questions. Do you have enough money to live comfortably? But it actually gets at something. When we're thinking of life cycle models, if they go, okay, what is the utility function? How does the utility function change over time? That's really hard to figure out. Or we could just ask people, how you doing? And it really is a surprising answer that the vast majority of retirees say they're doing okay. Only a tiny, tiny slice, roughly 5%, would give you an answer that would be equivalent to retirement crisis, or I'm finding it difficult to get by, those sorts of things. And so I think the challenge for researchers is bringing the models and these data, reconciling them and saying, well, why are retirees so happy? And I think John Cogan's presentation, well, they got much more income than they used to. That's a pretty reasonable explanation for it.
Gopi, do you want to answer or give thoughts first?
One thing I wanted to say is that some of the ways that people, quote, pay for long-term care is by relying on family members. And so if you're asking the retiree, maybe their needs are met, but you're not taking into account the opportunity costs that puts on the caregivers who are other family members. And I think if you take that into account, then it's long-term care is actually much more costly than what you would just measure as what they're paying for formal care services, if you kind of take that into account. So I think we are paying for it in ways that we don't always measure. That would be one way that I would respond to that comment.
So I would just add that, and Andrew, you're kind of getting at this. When all you have is a hammer, the entire policy world looks like a nail, right? And so you keep smacking it with your hammer, and that's all you want to do. And your point is basically that there are differences in data about what the perception is versus reality. And Gopi's saying, well, it depends on how you ask the question, what data you look at. And so what I would get to is that this is a more nuanced problem. And again, thinking about it holistically, but who are the challenges for, and how do we target reforms to those people who need the help? And I think that's where we start getting into Social Security, because too often you hear people say, well, cut benefits across the board, or let's increase benefits across the board, where neither one would actually solve the problem of helping and assisting those who actually need it the most. So we do need better data. We need actually better ethnographic and real data to back it up, to say where are the anecdotes showing that is actually reality for more people, and where is it just 1 or 2%, and there's some small policy tweaks we could fit. So I think the point is, again, we have to think more holistically, but also dive down and see where we actually really do need to have the problems that we need to solve.
So I'm going to Kristen and then John, and then we'll kind of morph into a more general discussion about everything we've talked about today. So
Yeah, just thank you. find the idea of turning Social Security into, from sort of thinking about it as an earned defined benefit to a true insurance program very fascinating and very appealing. And I'm wondering, particularly when we're opening up potentially Social Security be funding with other sources that are not, just payroll taxes, how this impacts your thinking on the generosity of benefits and criteria for eligibility to make it more of a limited Social Security program. And I will say my own bias is once you open up Social Security to general revenue, you have to start thinking about the opportunity cost of what that general revenue could alternatively be spent on. So like food stamps, education, et cetera. And it makes sense to me that we might have some dedicated general revenue for a very limited in social insurance old age program. But when I'm thinking about, say, the 95% or whatever of retirees who are reportedly happy, the couples who are earning $100,000 in Social Security benefits a year, preserving that, even though they have sitting on $5 million in savings, that doesn't seem like a wise use of general revenue. And so with that spiel in mind, I'm wondering how, if you were going to see congressional reform to transform it into a more limited social insurance program for true, like insured unexpected risks, what would you kind of be looking at for generosity of benefits criteria?
So two ways. One, you could do other revenue sources without changing the benefit structure, right? So basically, you could just say we're going to still base it on your income and how you've been paying in, but we're still short 20%, right? So you got to figure out how to make up that 20%. That could be other sources. I too am not a big fan of using general revenue. I would like an additional revenue source. Again, whether it's a carbon tax, which if we're hopeful, it'd be a declining revenue source, so it wouldn't solve a 75-year problem, a very small financial transaction tax, like 0.001%, basically gets you, I don't know if it's like $100 billion over 10, but you could start ratcheting this up, or a small consumption tax. I'm just concerned we're putting way too much tax, income, and payroll on labor, and that's just too high. So again, then thinking about this from the insurance standpoint of what it actually means, you could calibrate. Again, you can change benefits or not, but just think about how we could fund something differently to make up the gap, I think is an important way to start with this. And then talking about it as an insurance program and not a pension plan would also be helpful. And that would allow when somebody's then talking about overall. So imagine we talk about this as retirement security and income was actually what we were focusing on. You could give everyone their exact same Social Security benefit, but when they file their income tax return, it's going to show whether they had income from other jobs, from investment sources, from self-employment, from farm income, et cetera. And we have a general sort of idea that Social Security should provide a flat benefit or some sort of income replacement rate, and that becomes a calculation on line 76 of your 1040, and you recapture the additional 1040 or additional Social Security money, which then goes back into the system as a revenue source. So it's not means testing in that way, but it is a taxation of benefit based on income.
Yeah.
And so that kind of fits in philosophically how we actually do taxation in this country.
So one more thing I want to add is like the financing of such an insurance program doesn't have to be from general revenues. It could be from a payroll tax. And the analog here is just Medicare. So we put in a payroll tax that's based on earnings. What you get out of the Medicare program has no relation to what you put in. And what we think about Medicare as is just an insurance program, right? That's there and it pays more to people who need more healthcare benefits. But it's not, there's no, I don't know, there's no sense in which that we're thinking about those contributions as being returned back to us necessarily.
And you also could reframe, we could call our payroll contributions, that's what we do for seniors in Medicare, it's a premium. So your Social Security, you pay a premium for your Social Security because it's an insurance program. He's already laughing at me.
You're a tricky man.
Andrew's not buying me drinks tonight, so I thank you.
So very nice presentation, both of you. They're really, really terrific. I totally agree with the holistic approach that we should be taking to these issues. Gopi, you outlined sort of several ways or several ways of thinking about goals of Social Security, poverty, wage replacement. So I have a question about the current, what your thoughts are. I think I got a little bit from Jason in his last answer. What your thoughts are on the current method of wage indexing. It's a wage replacement. It has a wage replacement goal, right? And so I'm wondering now, as you think holistically about retirement income and where Social Security fits, would you say that's the right goal for Social Security? or whether that goal should be modified, along the lines of what John has said, a flat benefit or some other type of structure.
That's a good question. I do think I agree with you that wage replacement is implicit in the wage indexing in the program. And is that the right goal? I think that what is challenging about wage replacement or income replacement in retirement is that we don't have it's not clear that 100% is the right number. It really depends on a lot of ways that people envision their retirement. It depends also on their health status in retirement, just what they think of as an appropriate replacement rate. There's work, some of which that I've contributed to, that thinks about what is your marginal utility? What is the added benefit that you get from additional resources in states of the world where you're healthy versus sick? And how do you think about it differently if the thing that you're sick with is a cognitive limitation versus a physical limitation? And I think targeting certain replacement rates is not necessarily the way that we need to think about a retirement program like Social Security if we're thinking about it in a risk management lens.
Terrific, thanks.
Great. So I'm gonna, I've been looking at a lot of the questions, and there's kind of, I'm gonna ask, I'll tell you the second one first so you guys can think about your answers to this, which is kind of what's gonna happen, and then I'm going to go. There's an election this year where no one has addressed this question, and I'm going to. I've talked. We've had in our pre-call. We said no one's going to talk about it in the 2028 election, and so the question is, 2032 is kind of close to the deadline, right? And that's a presidential election. Is anyone, first of all, is anyone going to talk about it before the election about what they're going to be doing, or is it going to all come afterwards? And then how will it come afterwards? So I don't know if anyone wants to, But first of all, I'm going to ask you guys for a vote. Is anyone going to talk about it before 2032?
Yes.
Yeah.
Yes. Any of the candidates?
Well,
Yes.
talk is cheap.
I will disagree. I will disagree to some extent. I'm not sure like a presidential candidate will talk about it before 2032. I think it's possible that we get like senators and congressmen and stuff that will talk about it. Okay. And a president candidate might be forced to, but
And by talk about it, I mean proposing something that would actually address the problems, which is harder.
No.
As opposed to saying we're going to increase benefits. Yeah, go ahead, John.
So I think it will be addressed before 2033 or whenever. And my reasoning is really looking at history. And so Social Security has had two times when it's faced financial problems. First time was actually in the late 1950s. And in 1958, the trustees told Congress that the program was going to run deficits for the next 7 years if nothing was done. They raised taxes, didn't reduce benefits, but modified other provisions of the law. And then, of course, as we talked about in the 1970s, 6 years before Social Security's point which you could not pay full benefits, Congress and the president acted. In fact, they acted before that. Jerry Ford proposed a very significant reform of the benefit structure during the 1976 election. And of course, Carter outlined a plan during the same campaign. So when I look at history, what I see is you've got an enormously successful program that provides benefits to tens of millions of people. You've got a history where the pressure mounts on elected officials to preserve the program in some fashion. And in the two times that the pressure has been there, Congress has acted and resolved the issue although partly maybe by optimistic economic assumptions, but nevertheless, they've addressed it and provided a solution. And of course, 1983, they did it again, but the warning signs were delivered very late, very close to the point at which Congress, point at which the program couldn't pay benefits. So that's why I look at history, and that's why I'm optimistic, not by looking at our current political class.
I think part of this, though, when you think about like what's going to happen. So I was wrong 4 years ago, so I'll probably be wrong again. But 4 years ago, when President Biden was running for presidency, he kind of hinted he'd be a one-term president. Now he is, but not by his choice. And had he stuck with that from the beginning, he probably could have done Social Security reform, a commission or something, because a Democratic president with at least one chamber of a Republican, you all go off the cliff together. He could have saved Social Security. He didn't. And I think that's a big shame. Because now if we have President Trump, he may or may not take the second term to Social Security reform, but a Republican. If it's Kamala Harris, she's not touching anything because she'll want to run again. So you're looking at 8 years out. So now you're getting close to trust fund depletion. And this then leads to that brinkmanship. Like if we get to that point now where the president's not going to take leadership and we get to trust fund depletion, what happens? The assumption, I think John's mentioned this, is that Congress will, at least in the short term, probably just borrow money. $350, $400 billion a year. We will see that ratcheting up as we get closer to trust fund depletion, because as the trust fund goes down, they'll get to borrow $100 billion, then $200 billion, then $300, and then you hit the $4. And that was going to be my default until the last year or so. We've now started seeing hiccups in the Treasury market auctions. I'm not sure we're going to have 9 years in which the bond market is going to let us continue borrowing at our current rate without drastically increasing interest rates, which will also crowd out other spending and may actually cause us to do something sooner than trust fund depletion because we're not able to actually manage our money properly and pay our bills.
The higher the interest rates go, the higher the interest rate on the trust fund.
And the-
So it
and the
becomes-
COLA
it's
goes
like
up,
the
yeah.
self-licking ice cream
It
cone.
is, yeah.
What I think will be interesting to watch is, I mean, right now, partially for Democrats, even more so for Republicans, you just have this mathematical inconsistency. Thinking back to President Biden and Vice President Harris, they've proposed maintaining or even slightly expanding full benefits, but they've put forward only a tax increase on people earning $400,000, which is insufficient to finance that. President Trump has said the same benefit promise with no tax increases on the table. As you get closer to go time in 2033, you're going to have to figure out how to pay for your promises. And I think that's going to be a particular issue for Republicans, because even as they're shifting with an aging support base towards the idea of not cutting benefits, they're still ostensibly a low tax party. The Democratic Party isn't really, so they have a practical inconsistency of, they understand that raising taxes by the amount to keep these promises is politically unpopular, but they don't have a deep-rooted philosophical inconsistency. Most of them would do it if they could. Republicans want to say we are a low tax party while being a high entitlement spending party, and that's not going to work out very well. So this may be an interesting awakening. They're going to have to. It'll be a practical political problem, but I think for Republicans in particular, they're going to be rejiggering their philosophical views very, very quickly on this.
One additional point that I'd make is that if you ask why has Social Security been so successful, why is it the most popular program for decades and decades? And the answer, I think, in part, is the fact that it has this earned right principle. There's a rough relationship between the benefits that you get and the taxes you pay in. And so what worries me about general revenue financing, besides the fact that it's a complete gimmick unless we have an additional revenue source that we're willing to raise to finance it, it's you're undermining the principle, and you're turning the program more into a welfare program, and undermining, I think, the reasons for its success. So to me, the genius of Franklin Roosevelt was to tie those benefits in some fashion to the payroll taxes. And my hope is that we would try to continue that principle.
But John, can I disagree with you a little bit on that in terms of how the sort of political economy plays out? You're right that the idea of earned benefits promotes the political support of the program. And it makes it more difficult to cut benefits because it's not if you're getting a pure welfare benefit, some giveaway from the government, and we reduce it, we say we don't have enough money to do it. You understand that's not something you deserve. When you have this perception that I've earned these benefits, it's an entirely different sort of emotional and psychological reaction. Now, if the problem we face is we all think we've earned our benefits, but we haven't in fact earned our benefits. If you look at projections from the CBO or from the Social Security actuaries, you take people retiring in the mid-2030s, right when Social Security's trust fund runs out, they are promised benefits something like 25% higher than the taxes they paid over their lifetimes plus interest on those taxes. So the problem is we think we've paid for and earned our benefits when in fact we haven't. But I think more broadly, this earned benefit philosophy leads to you paying $100,000 in Social Security benefits to a high-income couple. Again, going back to the public purpose of this, if you ask people, why do we have Social Security? They'll say to insure against poverty and old age or something. That's cheap. The expensive part is paying $100,000 to a high-income couple. All you are doing at that point is displacing household savings. They're not insuring against anything. You're just simply saying, hey, you save less, and oh, guess what? We're going to tax you more for that, and input that into your models. Hey, what does that do for the economy? So, but I think that the philosophy of the earned benefits, I completely agree on the political effect. But I think at the end of the day, it's an impediment to doing what we should be doing to make Social Security solvent and effective.
Well, I've no disagreement with the proposition that if we start general revenue financing Social Security, the support for the program will go down and benefits will be reduced. I do think that is a practical outcome.
By the way, I agree with everything that's been said, but you asked, what do I think is going to happen? I think we're going to raise, the general revenues are going to be used. I don't want it, but I think that's what's going to happen. And maybe in the long run, benefits will be reduced. Maybe the income tax or the corporate income tax or who knows, a carbon tax. But I just don't believe benefits are going to be cut 21% either across the board or the plan that you've made. That's just not going to happen. And I don't think we're going to raise the payroll tax, probably by 4 points by then.
Yeah, 4%.
So I think that's the path of least resistance politically. I'm not talking as an economist. I'm talking as an amateur political scientist.
Well, you have history on your side because we've seen that the one thing Congress is willing to do and able to do easily is keep borrowing money.
Well, it's not necessarily. Maybe it starts off borrowing money, but I think in the long run, because of the bond market and so forth, they will raise taxes, but it won't be the payroll tax. That's my guess.
I share your pessimism about Congress's and the responsibility and to be financially cautious and the one thing I could see limiting the ability to issue debt to pay full Social Security benefits in 2033 and going forward is just the bond market's ability to keep buying these government bonds at greater and so I think the bond market pushes back and suggests that and it becomes financially, it's just too much for the executive branch to keep borrowing at, maybe the rates go so high that it just is financial suicide. I think that we'll see a stop to the borrowing. And I guess the question I have as a lawyer for you all is, when do you think that might happen?
So, and that kind of plays on to, what do you think, we're saying, oh, this is going to happen, the bond market is going to change. Presumably, bond market people are pretty smart and thinking about what's going to happen today. They're projecting out and having the same implicit conversation that we're having about what's going to happen in 2032. So they should be providing, thinking of that and pricing it into bonds today and what they're buying. And the question is, what's going to cause them to change? Are they thinking that there's going to be a solution that involves anything other than general revenues, or do we have any idea?
So, John, before you give the expert answer, let the amateur go first. You're already seeing different rates from the 10 and 30, not just based on duration, but potential risk. But we're also starting to see, and was it James Carville who said he wanted to be reincarnated as the bond market because it was the most powerful thing he ever witnessed because it forced discipline? We are starting to see now with the U.S. reserve currency that other foreign governments and banks are holding less dollars. Now, from a supply standpoint and a demand standpoint, other currencies combined cannot make up what the U.S. dollar provides when it comes to liquidity. But we are seeing it decline over the last several years. Now, what does that mean going forward? Will the dollar lose its reserve currency? Will it just be diminished? What makes up for it? What currency is it? Crypto? What comes into play? But we are seeing trades happen now. So the dollar is being held less and less over time. So I think we're starting to see issues. Now, are we going to have a debt crisis tomorrow? No. Next year, probably not. What does it look like 3-4 years from now? Can we get to trust fund depletion, to your point? And I think we're going to start seeing it. And I've been using the analogy that people always use for bankruptcy. It happens slowly and then all at once.
Hemingway.
Okay, thank you.
But the current 30-year bond is yielding what, 4.2, 4.3, something like that. So the bond market, bond buyers are more relaxed than we're letting on. I don't know. But I do think I don't see benefit cuts and I don't see payroll tax increases happening. And I don't think it's all going to be borrowing because the bond market may. So I think it's going to be general taxes and income taxes and who knows, estate taxes and the whole corporate taxes. Corporations are always, it's good to raise their. I mean, politically,
Yes.
let's tax them because we can't really understand who pays that tax.
Bingo, yeah.
It's interesting when you read about, say, this Congressional Budget Office has this long-term model. They project the federal government's finances out decades, and you'll sometimes read in the footnotes, well, if we keep going this current route, the model crashes. It can't solve for itself anymore, and the reason for that is these models, for the financial market to work. You assume the financial market assumes that at some point we raise taxes or cut spending in order to service this debt. And I think if you're looking at current interest rates, that's correct. They are assuming they're going to get repaid. Otherwise, we would have a financial crisis not 20 years from now, but today. My fear when, like Jason talks about, okay, we just think they're just going to borrow the money in 2033 is if I were the financial markets, that's the point where I'd say, okay, I've got to get out. Because I do think there's a difference between having a budget baseline, which is unsustainable in some spreadsheet sense, versus Congress and the president saying our actual policy is to have unsustainable levels of borrowing. And I think that there's always this tipping point. And for me, that's where I would head out the door, I think.
Interest on the debt is probably going to matter more than this abstract concept of debt that we have. It's real, but in most people's mind, what's the difference between 26 trillion and 28 trillion, right? Right now, interest payments on the debt account for about 35% of personal income taxes. In 10 years, it's going to be 45% of income taxes. The idea that we're going to be raising income taxes really strikes me as, already 45% of my income taxes are going to bondholders on Wall Street, bondholders in foreign governments and so forth. And so I sort of see this over time. It's not going to be so much the debt that's going to spook taxpayers. It's going to be the fact that so much of their tax dollars are going to pay interest on the debt instead of going for programs that they would all support with their tax dollars. So the support for that income tax, I think, is going to shrink as the interest payments as a fraction of those personal income taxes decline.
And John, to your point, because politicians and media, we all love sound bites. And as the interest payments continue to rise, it makes sound bites a lot easier.
Yeah.
So we are either at now or approaching $1 trillion a year in interest payments. That is more than we pay for our national security in the Defense Department. Right. And you mentioned the idea of foreign governments. So a lot of foreign governments hold U.S. debt. One thing both sides seem very happy to do right now is China bash. China holds U.S. debt. And at some point, I'm not sure we've hit it yet, or we're getting close, but the interest we are paying on our debt that China holds will be enough to cover their military expenses. In other words, U.S. taxpayers are financing China's military. Those are sound bites that are going to come out, and that's going to change how we sort of the nature of this conversation about income taxes, spending.
Not to get into the truly nightmare scenario, but both Jason and I have spent a long time working on the bankruptcy of the Puerto Rico government, which is obviously of a different scale than the federal government. But one thing I'll say from having been involved in that process is the most difficult time for a government facing insolvency is right before it goes insolvent. When they are saying, we are going to make these debt payments that are either they're squeezing out everything else in the budget, that's the toughest time. As soon as they default, as we found in Puerto Rico, they're swimming in money because they're running a primary surplus. And so then the question is, well, what do we do with it all? So I do think, especially with the overseas element and who are we giving this to, I'm not saying today, and I'm not even saying 10 years from today, but at some point, people start to say, "Oh, why am I giving up all these essential programs for these vulture hedge funds or however they want to pose it?"
Okay, so I'm going to go to John, and then I'm going to go around the table to get your final comments about what you think. What did you get out of today, or what you think is going to happen, or something that you want to make in a final comment. So, John, go ahead first with your other point, and then we'll go to start.
So fixing Social Security has benefits that go beyond Social Security. If we fix Social Security without relying on general fund revenues. Back in 1983, when the Greenspan Commission got close to finishing its work, someone on the commission, I can't remember who, raised the question, gee, we fixed Social Security. What about Medicare? Because Medicare was scheduled to go bankrupt or be unable to pay payments in several years hence. And so the commission then looked to HHS and proposed the most significant reform in Medicare to that date. We went away from cost reimbursement for hospitals to the Medicare prospective payment system, and that was included in that 1983 reform package. So the lesson that I draw from that is if Congress manages to fix Social Security without a general fund bailout, it is naturally going to then go and ask, well, gee, what about military retirement? What about civil service retirement? What about Amtrak subsidies for white-collar workers traveling from New York down to Washington, D.C.?
Hey, don't attack my side.
What about all these programs that, in many people's minds, are less worthy? I think the opportunities, just like for Medicare in 1983, I think the opportunities will come up. And so that's why I think the stakes for the budget are even higher than for Social Security by itself, as important as Social Security is as part of the budget.
Okay, why don't we go around? Gopi, do you want to start?
Sure. So I first went to a Social Security conference with John as a research assistant more than 20 years ago, and it really solidified my interest in studying these issues that we've all been talking about. And what I learned from that conference is that there is no shortage of ideas of how to address the problem. And I think that is still true today. Just in the last 3 hours, I think we've heard so many creative and interesting possible solutions. I thought then, and I still think now, that the issue is really a political issue in terms of how we come to an agreement about how to take some of these ideas and put them into action. And the only difference is the problem is more dire now than it was 20 years ago. And so I think it's time to kind of take these ideas that have been put forth by decades of research and thinking by lawyers, economists, and everyone in between, and really think about how we can come to some solutions.
So I will, I guess, repair it myself and talk about the three-legged stool and how we have to rethink again about what it means to have retirement security, thinking about income as the outcome and thinking holistically about reform. I know this is about Social Security because it's the bedrock program for so many people, but we can't sort of put the full burden on Social Security reform when thinking about retirement security. We have to, again, look at the defined contribution plans, 401ks, 403bs, IRAs. How do we help encourage access and participation? How do we help people understand their savings options and then their spending options? We've been using accumulation and decumulation. No one likes that term. So let's think about it as saving and spending. How do we have a spending plan? Again, and thinking about how to manage risk in retirement. So I think if we start having these holistic conversations now, it might even make Social Security reform easier when the point comes where we're doing it, whether it's next year, whether it's at trust fund depletion, because we are talking holistically about Social Security, retirement security, and that might make the tweaks, like Andrew, some of the work that you've done, more palatable for politicians. So again, go back to redefining the three-legged stool, thinking about income as the outcome, and let's talk about holistically what it means to have retirement security.
So I've been reading Gopi's work, John's work, and Andrew's work for years, and I've learned a ton from them. So for me, it's been another learning experience from these three. Kristen, I thought your presentation was an absolute eye-opener for me. Really started me thinking about the strategic consequences of your analysis as well as the practical outcomes. And Jason, your thoughts about the holistic approach are absolutely the right way to go and the only way to go now when thinking about Social Security reform. So I've gotten an awful lot out of it. So thank you all very much.
Well, I also have gotten a lot out of this, and I can't summarize it. But I would say, back to my presentation, Reagan and Tip O'Neill, they agreed to get this fixed, and they put the commission together. And I'm thinking, well, why did Simpson-Bowles fail? And it's because they didn't have the president and, say, the Speaker of the House or whoever agreeing that it needed to get fixed. So I'm back to history, but I do think that that combination of the leader of the Congress and the president tackling the issue is what made it happen, and we need that again.
Well, I just want to reiterate what John Cogan said. I just love this format of just people interrupting each other and talking, and I think it's proved to be really, really interesting. Coming out of it, I just really have two thoughts. First is I think Social Security is primarily a political problem, by which I don't mean Democrats versus Republicans, one is right or one is wrong, but thinking about political structures and really why is it that this is so difficult to solve? I mean, last year we had a conference here about the 40th anniversary of the 1983 reforms. But what we are today in 2024 is the 40th anniversary of realizing in 1984 that we still had this long-term deficit and the 40th anniversary of not doing anything about it. It is worth asking why the U.S. has not been able to fix the Social Security problem while other countries, again, I'm thinking Canada, Australia, UK, New Zealand, have gone about and often had multiple fixes. So this is a political structures problem. The second thing, I think, is the solution to this is to think about must-haves and nice-to-haves. Think about why we have a Social Security program in the first place. Do we want to prevent poverty in old age? Yes, we do, and we can do a better job of that. Did we have, a century ago, were they thinking we need to have this program to pay $100,000 a year to a high-income couple? I think the answer to that is probably not, and certainly that's something you can give up, you can give in on. There is money to be had on that end. And I think just as we recognize in a kind of cross-sectional sense that high-income Americans need less assistance from the government than low-income Americans, we can also reasonably say, as we go forward in time, horizontally, that as the country grows richer and richer, as retirement savings get larger and larger, maybe we can scale down the benefits at the middle and upper end and have people rely more on their own savings. That's a solution that's not instantaneous, but by thinking about what we need this program to do and what's optional, I think that paves the way towards something that's more reasonable.
Thank you for everyone. This has been very educational and thought provoking. 2 points on takeaways from today. The first is what I hope everyone gets from our presentation, which is I've been mulling over in my head for a few months, is really when you realize the status quo baseline of what happens in 2033 if no reform. It makes me think that really reform is about how much fiscal pain are we going to inflict on the nation to preserve full benefits for the wealthiest retirees. And that's sort of the way I approach reform efforts now. What I get from everyone else's presentations and sort of the overall takeaway for me here is I agree with Gopi. We've heard a lot of creative ideas about how to approach fiscal Social Security and solvency when we're talking about reform. And one thing I note is I gather, I just suspect, I don't know you all personally, that we represent a range of ideologies and political beliefs, partisanship, et cetera. But I also don't sense a ton of disagreement when we're talking about reform on sort of the ultimate goals for the nation, which in some ways is very encouraging that, people can come together, seriously study the issue, and find common ground, significant common ground on this. I still remain skeptical that actual politicians will be able to do that, despite the optimism, provided today.
So I want to thank everyone. First of all, I came into this kind of going, I've thought about Social Security, and I was kind of like, we're never going to have something. Just the positive attitude of we can get something done, and there are reasonable options was something that I got out of today, and that we can possibly do something. But and so I want to thank the panel for everyone. It was great. I learned a ton. It was great to see you all and learn from it. I also want to thank the CPR staff and the video audio crew that most of the people or everyone online can't see, but they've done hopefully done a phenomenal job. They've made our lives easy and made this format, I think, work really well. I really like this format much better than having 2 people come up and have an audience Q&A. I like having the experts talk about it. You guys were all great with each other. So thank you very much. And thank you, Gopi, for being the patient person online and waiting for everything. So with that, I think we're going to close the conference. So thank you very much.
Thank you.
Thank you.